Hi, my name is Dr. Ari Isaacson, and I work at IR Centers Raleigh, and I perform prostatic artery embolization, or PAE. This video is meant to help you understand what it's like to get a PAE at our office. So please take a few minutes to watch the video, and I hope that it answers all of your questions.
So I'm actually going to send it to your email if that's okay.
I went to medical school at the University of Southern California. After I graduated, I served in the Navy for a few years, and then I ended up at radiology residency at the University of North Carolina. I stayed there for my interventional radiology fellowship, and when I completed that year, I was hired as an attending radiologist at the University of North Carolina. I practiced interventional radiology there for 8 years before I decided to come here and open up this practice, IR Centers Raleigh. The reason I made the decision to come here is because I wanted to have the opportunity to have a practice that really focused on patients, where patients could have convenient parking, walk in the door and feel like they're getting personal attention, see the doctor before and after the procedure and as much as they wished, and be able to contact the physician also if they wanted to call and ask a question, that they would get a call back from the doctor, which is, I hear, relatively rare these days. This practice allowed me to do that, as well as perform procedures that I really enjoy, which are embolization procedures, and specifically PAE, or prostatic artery embolization. Hey there. Hey, how you doing? I'm Dr. Isaacson. How are you?
All right.
Okay. Do you have any questions for me about what we're doing today?
What we do is, during your prep, what you can expect is that we'll bring you back. We start an IV, get you in your birthday suit, get you in a gown, get you some fun little grippy socks and some warm blankets, give you a couple pre-op medications, and give you Valium. If you're feeling nervous, that is optional. Dr. Isaacson will speak with you, as well answer any questions. If I didn't answer anything for you, he can do that. So he meets with you pretty quickly.
Okay, hello.
Hey,
how are you doing? Hi, I'm Dr. Isaacson. So our plan for today is
when patients arrive in our office, majority of our patients are nervous and anxious, and they don't really know what to expect coming in. We really like to inform our patients that there's no pain to be expected with this procedure, but they do also get to speak with the doctor before the procedure, and that tends to help calm their nerves, because he will then answer any questions that they have, and we can also go over the procedure again and recovery process.
So tell us why you like to go in and talk to the patient.
Yeah, so I think every patient wants to see their doctor before the procedure. It gives them an opportunity to ask any questions. It's also part of the consent process, so part of them giving consent to do the procedure is that they've had all their questions answered. So it's important that I give them the opportunity to ask any questions they have before they go in. And then what I really want to, the message I want to get across in the morning is just a message of encouragement that this is going to go well, and you're in good hands, and it's not going to be painful, and it's a good first step to changing the rest of your life.
We take you back during the procedure. We'll get you hooked up, get some vitals. That'll be monitored every 5 minutes. It's a little chilly back there, so we make sure we get you covered up with some blankets. One of the guys will usually shave your groin. They like to crack the joke that they're barbers. They're usually pretty funny, and they'll help keep your mind at ease as well.
How you doing, man? You doing all right? Yeah. Good, yeah.
A lot of the emotions that the patients are having, it's on a very large spectrum. We have some that are calm, some that are nervous, and of course the nervousness comes from the unknown. So I just really try to bring them in and let them know that, we're all on the same page, and once they're in our hands, they're safe, they're good.
Coming to IR Centers, you are going to definitely see that we do this all day, every day. So with us doing 4 to 6 cases a day, our cases tend to be 30 to 45 minutes. long. So that's made us very efficient at what we do here. This is what we specialize in.
I have two friends that underwent the procedure, and they both spoke very highly of the procedure. And so from that standpoint, I really questioned them a lot. Like, were there any side effects? Did you how was your sexual function afterwards? And I asked them a lot of questions that made me feel very comfortable.
I got in, they prepped me, gave me some Valium, I believe. I was like, okay, I'm not as antsy right now, but they did the IV. Doctor came in, we talked a little bit. He kind of went over what was about to happen. We went into the procedure room. He said, this is what's going to happen. This is how it's going to go. We're going to show you actually what we're doing on the screen while we're doing it. We're going to talk you through it so that you'll be at your highest comfort level.
What number of procedures is this?
This is somewhere between 3,500 and 4,000, somewhere in there, over 10 years. All right, well, we're on our fourth case of the day, so working on our efficiency, trying to do every case as perfectly as possible, but getting these patients out as quickly as possible so they can get back to their lives and they don't have to be spending their whole day in our building.
During your procedure, you'll always have a nurse in the back with you, and so we'll help keep you comfortable back there. And we also like you to be as involved as possible and be able to watch if you want. So the first thing he'll do is numb you up there in your groin, and once he's done with that, we take it away and we can pull up a TV screen where you can actually watch and see what he sees. Either I or one of the other nurses will explain what you're looking at and kind of walk you through it. I've been compared to, let's see, Vanna White, a Universal Studios tour guide. So I really walk you through it and make it really easy for you to understand. Branch that he needs it to first, and then the catheter slips down over into the vessel, okay? So the wire acts as a guide. He'll usually go in through the right and go up and over to the left side first. So I explain that, I point out where the catheter is and the wire that he uses to guide the catheter. I show all of that to you and make it really easy to understand. So patients tend to really like that. It helps kind of distract you and you're not just staring up at the ceiling. And yeah, so it's really fun. You get to watch the procedure and we'll just monitor your vitals throughout. But again, no pain, so you're pretty nice and relaxed. You get to listen to music with us, and we'll crack a few jokes if you're lucky to. After the procedure, once he's done, he just removes his catheters and he'll get you closed up with a little closure device. No stitches involved, and then we'll take you back up front. And usually the hardest part for patients is going to be laying flat for 90 minutes. And so if that's the hardest part, then I think that's pretty easy.
Then I went back to the recovery room for a period of time, maybe 90 minutes. And then my wife came in, we sat there for a while, and then they took the IV out and I left. So it was pretty good.
Hi, so I'm going to start going over some of the discharge information with you before we get you up. After they come back from the procedure, we like to check in on them around every 15 minutes just to check the incision site, also check some vitals, just to make sure they are stable. We also will go over discharge instructions with the patients before they leave. They will have a packet of information that they will go home with. When I do my 1-month follow-up phone calls, I like to check in on the patient to see how they're doing. I always like to check to see how the recovery process was. I always do like to inform them they can still continue to see improvement for the next 2 months because they should see the full effects of this procedure around 3 months.
Most people possibly not go through the procedure because just fear. Coming from that angle, I definitely want people to understand this procedure has been beneficial for me.
Compared to the other procedures that you can have, It is one that comes with the least amount of side effects, the least amount of pain, and it does not prevent you from having anything else done in the future.
I would definitely recommend having it done.
My advice that I would give is definitely call us. You're more than welcome to come into our office.
And I was telling my spouse that, hey, I think this thing is working. She was happy because, you know, when you're going through something like this, then it's affecting everybody around you.
It's a very personal decision, and everyone should be informed and see doctors that do each of the procedures that they're considering. But PAE does offer the advantage of minimal pain, minimal risk, and a quick recovery. Thanks for watching the video. I hope this has been helpful. If you have any other questions that haven't been answered, feel free to reach out to us, and we'd love the opportunity to see you as a patient.